Hi, my name is Tamara Weel. I'm the lead hygienist here at Precautions Dental, and today we're going to be talking about that dreaded topic, flossing. A lot of patients come in and they just dread that conversation with either myself or the dentist about learning how to floss or need to floss more. So today I'm going to put a wrap on that, and I'm going to teach you how the proper ways of flossing and answer any questions that you may have. So let's start from the beginning. What is flossing? Flossing is a tool that you use to clean in between your teeth and underneath your gum tissue. You can be used in many different forms, so such as braces or bridges. We have a specific floss such as this. It's a hardened end on it, and you can go in between the braces or the bridge quite easily. Other things that we can use is either a pick like this or a thread such as this one right here. So what are the benefits of flossing? Flossing removes that bacteria that's sitting in between your gum and your tooth tissue. So if you remove that bacteria, things like cavities, tooth decay, even tooth loss can be prevented. If you leave the bacteria and plaque in there, what can happen is either gingivitis, which is infection of the gum tissue, or even worse, it can cause bone loss, which is periodontitis. That's destruction of your bone and anything that is holding your teeth in place. If you keep leaving that for too long, it can even have risk factors of heart disease or even as well as diabetes. Other things that floss do is help with bad breath. Bacteria that is sitting in between there also smells, so that can cause bad breath. As well, it doesn't quite look aesthetically pleasing if you have foods trapped in between your teeth. So not only does floss help with aesthetics, it also helps with your oral health as well as your entire body. So how often should you floss in a day? Recommendations would say at least once a day, if not more. The food that's sitting in between your teeth sits there all day and then can cause further problems, what I had mentioned before. So once a day is essential. Again, if not, more is probably best. So how do you floss? I'll just show a diagram here. Now you want to have the floss quite taut between your fingers, so I would say either your pointer fingers like this, your index fingers, or you use your thumb like this. You go in between your teeth, start from the beginning, and then wrap it right around your tooth, such as this. We call this the C-shaped method. Make sure that it's quite hugging your tooth, and then scooch all the way down till you feel that base. You won't see your floss anymore, it will go right underneath your gum tissue, and then scoop up. One thing we don't want you to start doing is going in and out like this, because that's going to start cutting into your gum tissue and causing you to bleed. Flossing shouldn't be painful. That's why you should curve around, go right to the bottom and scoop up, and you shouldn't have any bleeding. If you do have bleeding, floss for at least 2 weeks, and if it continues to bleed, please contact your dentist. For any further questions or concerns, please don't hesitate to visit us online at expressionsdental.ca or give us a shout at 403-252-7733, and we'll be happy to help you. Thanks so much.